Hello, my name is Scott McLarty and I am a member of the Green Party. Someone is watching this video who doesn't have health insurance. Someone watching this video has had a health emergency or knows someone who had a health emergency, and the insurance company said, "No, we will not pay for it." Maybe it's a family member or a friend or someone you work with. Maybe it's you. That's the story for millions of Americans right now. Over 50 million do not have health insurance. Millions more have inadequate insurance coverage, not enough when they face a serious illness or accident. Many people believe they have a good health insurance policy until they face an emergency. When that happens, it means personal bankruptcy, financial ruin, their life savings wiped out. America has the best medical technology in the world, but we have one of the worst medical delivery systems. In every other democratic industrial country, the government makes sure that every citizen has access to health care, but not in the United States. There's a solution to this crisis. It's called Medicare for All. Sometimes people call it single-payer national health care. How does Medicare for All work? We expand Medicare to cover everyone. Medicare for All will cover every American regardless of employment, ability to pay, age, or prior medical condition. Medicare for All will provide everyone with high-quality medical treatment and full choice of doctor and hospital. Decisions about medical treatment will be made by doctors and patients instead of insurance company bureaucrats. With Medicare for All, no one will go broke because of a medical emergency. Medicare for All will boost the U.S. economy by relieving businesses of the financial burden of providing health care benefits for employees. Americans would pay for Medicare for All in the same way we pay for Social Security, but will pay far less because the high cost of private insurance will be eliminated. Private insurance raises the cost of health care as much as 30% to cover administrative overhead for executive salaries and bonuses, profit margins, and other expenses. Compare that to Medicare's current administrative overhead, only about 3%. Insurance companies make their profits by restricting health care and by denying treatment to people who need it most. If you have a heart condition, if you're over 60 years old, they don't want you as a customer. For-profit health insurance is designed mainly to make money for insurance companies. It's time to replace it with Medicare for All, which is designed to deliver health care to all of us. Everybody in, nobody out. What about the Affordable Care Act? That's the bill that Congress passed and President Obama signed in 2010. When they enacted this bill, they acted in the interests of insurance and other corporate lobbies. The Affordable Care Act requires everyone to purchase private health insurance. That's what individual mandate means. The mandate is a direct public handout to sustain the private insurance industry. Even with the mandate, the Affordable Care Act leaves 23 million Americans without coverage and many millions more with inadequate health care. The Affordable Care Act was a gift on a silver platter to insurance companies and other corporations that sent millions of dollars in campaign checks to politicians. President Obama and Congress could have pushed for Medicare for All, but they decided to serve insurance companies instead. Democratic Party leaders held health care reform roundtables that included insurance company representatives and left out Medicare for All advocates. They declared Medicare for All off the table. President Obama even dumped the public option during backroom meetings with corporate lobbyists. Americans have a right to question whether it's legal for government to force us to enrich private companies by purchasing their low-quality health insurance policies. We cannot compare the health insurance mandate to laws requiring every car owner to purchase car insurance. Driving a car is a privilege for people with driver's licenses. Healthcare is not a privilege. It is a necessity for the basic right of every American to stay alive, to be able to make a living, and enjoy life. Americans already recognize that everyone deserves the right of personal safety. That's why we have public police and fire departments. Imagine if you had to call your insurance company first before you were allowed to call the police or fire department. Why do we tolerate it with health care? The demand for Medicare for All is based on the same principle. It's time for us to recognize health care as a human right, instead of a cash cow for corporate middlemen who take our money but don't actually provide medical treatment. The Green Party supports Medicare for All. Unlike Democratic and Republican politicians, the Green Party and Green candidates do not accept corporate campaign checks. Please help us win Medicare for All and make high-quality health care possible for every American. Learn more about the Green Party at our website, www.gp.org. Thank you.